Hello, everybody. I'm Lori Jo Vest, and I am here with Dr. Alar from Mile High Denture and Implant Centers. And we are here to talk to you about better living through full arch dental implants. Hello, Dr. Alar. How are you today?
Hi, Lori Joe. Thanks so much for having me on.
We are going to just dive right into the content here because I know with what our audience wants to hear about is what it's like to have full arch dental implants. So we call this presentation Better Living Through Full Arch Dental Implants because what I hear from all the patients that we talk to, it is a much better life after full arch dental implants than it is before, correct?
Absolutely. We measure quality of life factors before and after the treatment, and we see a stark increase. Patients are able to chew a wider variety of foods and more confident in their smile, often becoming more outgoing in social settings and more confident. So,
Love that.
definitely
Love
increases
that.
quality of life.
I think so too. From what we see, it really does. So, can you give me a description of what are full arch dental implants? What do we mean when we say full arch dental implants, and how do they work?
Right. So that's a great question. Full arch dental implants are basically 4 to 8 dental implants that are used to replace a full jaw of teeth. So with maybe 8 to 12 implants, we're able to give you a whole new mouth, a full mouth rehabilitation. And these are fixed teeth. They stay in your mouth. They do not come in and out. They
Mm,
look incredible. Um, According to what our patient desires to look like. Beauty is in
yeah.
the eye of the beholder. So, a big part of my job is diving into seeing what type of smile our patient likes. Do they want it more natural? Do they want it more perfect, a more Hollywood smile, or a more characterized natural smile? And that's a big part of my job is figuring that out with the patient and illustrating that in the prostheses. Um, these teeth are also the closest to what Mother Nature gave us as far as how forcefully we can chew and how well we
Nice.
can enjoy foods like steaks and nuts and salads, which can often be difficult for patients that are in removable teeth, such as dentures, to tolerate and
Mm,
have.
got it. Yeah, we hear so many great things, and there's actually an option that's called Hollywood White. Is that correct?
Yes, that is true. We have a broad range of colors, and we work together to pick a perfect shade for our patient. And it's more than just shade. There's definitely the shape of the teeth, maybe a bolder, square, more characterized tooth versus a softer, more uh, curved, ovate type of tooth. So we spend a lot of time discussing that with our patient and deciding what their ideal smile is. Some people will ask for a little gap, maybe because that might have been something that they've had their whole lives and they want to
Oh.
have that again. So it's a very custom process. No two look alike, even down to the color of the gums are very customized to what our patient
I
prefers.
love that. That's wonderful. So why
Mhm.
are they, let's circle back. Why are they the best option for so many people? And I'm comparing it like when people come in, what are they usually dealing with when they show up in your chair to talk to you about
Mhm.
full arch?
So, other options are basically conventional dentures, teeth that come in and out and aren't supported by implants, and also snap dentures or implant overdentures, which are
Mm,
still basically dentures that are just tethered in a little bit better with implants. Both of those options do come in and out, so they need to be removed at night, which can be uncomfortable for patients, especially patients that are exploring new romantic situations.
mm,
They also decrease in our forcefulness as far as chewing. So, our ability to masticate certain foods, chew up certain foods like steak or chicken wings, decreases. Most patients have to modify the way that they're eating. They're not able to
mm.
bite into like an apple or a sandwich with hard bread. Instead, they have to cut it into little pieces, put it in the back, and chew that way. Another huge difference, I think, with the fixed teeth that stay in your mouth versus dentures, whether they're snap dentures or traditional conventional dentures, is the maintenance.
Mm,
Um, Teeth that stay in our mouth, these full arch fixed teeth, have very little maintenance to them. They do need cleanings, just like patients with natural teeth, but there's no parts or pieces that need to be changed. The materials are very, very strong that do not wear down or break. So as long as we're keeping these things clean, they should last a lifetime. And we recommend water flossers, and we spend a lot of time in my practice discussing hygiene procedures, and we make sure to design the prostheses so it's very, very cleansable and hygienic. Whereas
Mhm.
with dentures, there's limitations. The dentures are made out of acrylic or plastic, and they just wear down more. They come
Mm.
in and out, so it's easy for folks to lose them. It's easy for folks to drop them and break them. And although those
Mm.
are manageable situations, it can be disheartening if you're at home and something happens, or worse, maybe on vacation and a tooth breaks or
Ah,
something comes off, or all that. Even the best patient that takes care of things very, very well, eventually those dentures will wear down, the teeth will flatten out, and you'll need a new set. An
yeah.
additional thing with the implant snap dentures is that there's components on the snap dentures that are designed to be replaced every 6 months or so. So
Oh.
although the snap dentures might have a upfront lower cost, long term, you're spending a lot of money on maintaining them with relines, with replacing the components, with repairs, and eventual remakes. So the fixed teeth just might have a higher upfront investment, but long term, you're saving a lot of money, you're saving a lot of time, and you're saving a lot of strain on your mental health from unpredictable
Mm.
things that might happen with dentures and implant overdentures, snap dentures.
I mean, a broken tooth when you're on vacation sounds catastrophic to me.
Yeah, it is
Sounds
it's an
horrible.
emergency, right? And if
Oh,
you're like on a cruise ship or something, you're not going to have a
oh,
dentist to that could ruin your whole trip, and your loved
yeah,
ones too, who see you suffer with it. I hear a lot of people
yeah.
that they come in with their loved ones, their spouses, their kids, and they are also suffering seeing their loved ones suffer. So
Oh,
all those things to consider that are
yeah.
easily solved with these fixed teeth. It's such a wonderful solution. So many pros to it. You're chewing better. The teeth are lasting you longer. You're not constantly worried about them breaking or not fitting well. So just a lot of advantages.
Got it. Now let's talk about when we were speaking before we started this live today. You
Mhm.
mentioned that there are some long-term negative effects of dentures. Talk to me about
Right.
those because somebody who just got dentures and maybe thinks it's a great situation or who's in that place of making the decision. Let's talk about the bone loss and what happens when you're in dentures long term.
Right. So that's a great thing that I think most patients should know about when they're making the decision to go into dentures or to go into fixed implant teeth. Um, with dentures, when the teeth are out and there's no implants in your bone, the bone just starts to resorb and shrink up.
Ah,
It happens a lot more exhilarated on the top jaw versus the bottom, but it does affect both jaws. It doesn't happen overnight, but for some folks, it can happen pretty quickly. And basically, when you take those dentures out, you see an immediate collapse of facial structures because we've lost
ah,
that bone. And it can just make it a little bit more tricky to place implants in the future. It's always doable with a different type of implant.
okay.
Just might cost a little bit more there. But with dentures, the cons of them breaking and needing replaced, another huge disadvantage is that constant bone loss that you're having underneath the dentures.
Mm.
So people usually know about, you got to take them out, put them in the cup next to you, but it's a little bit less known that you do lose your bone that Mother Nature gave you over time when you're in those
Mm.
dentures.
Now, is that kind of like when you have, when you get an osteoporosis diagnosis, they tell you that the ongoing pressure on the bone and like they say, weight training and things like that puts pressure on that bone, which keeps it from resorbing. Is that what happens with your
Right.
teeth and with the full on or the full arch dental implants? Is that you're putting good pressure
Yeah.
on the bone so they stay healthy?
That's a
Is
great
that why?
analogy. The dental implants basically stimulate your bone. So it's kind of like a
Got it.
use it or lose it situation. If you're not stimulating that bone, it's going to resorb and disappear on you. So, yeah, very similar to strength training when to keep bones from resorbing in the rest of the body.
Mhm.
Dental implants help to stimulate the bone and keep it intact. And without them, that stimulation is lost and resorption occurs.
Got it. So it's kind of like when you're eating those steaks and corn on the cob and the apples and that hard biting, you're actually keeping your bones in your mouth healthy, which you can
Exactly.
do with full arch dental implants, not
Right.
necessarily with the snap-ons or the standard dentures. So,
Yes, not at all with the snap-on, not at all with the regular dentures, and with the snap-ons, a lot of areas that don't have the implants, you'll see that shrinkage. The smaller areas that have the implants will be intact, but the shrinkage will happen in the areas without the implants, and we'll see rocks of the dentures, and that's part of their maintenance is
mm,
constant relines to, uh, compensate for that bone loss that's happening. Mhm.
mm. Yeah, I think that's a really important thing to talk about. It really is. Now, some people, when they see the actual what the full arch dental implant surgery entails with the implants into the jaw, they're intimidated by it. They're scared to death. They look at it and go, oh my goodness, I'd rather dentures don't do that. This is going to be easier
Mhm.
for me to have dentures. What do you tell those patients who are afraid of the surgery?
Yeah, it's very, very common and normal for patients to kind of get a ick factor or intimidation factor when they're thinking about dental implants going into the jawbone. But the procedure is no more uncomfortable than having extractions done by a professional who's good at doing the oral surgery.
Right.
We do all of our surgeries with oral maxillofacial surgeons. We do all of our full arch surgeries under sedation, so our patient is very, very asleep for it, completely sedated, and we still numb you under local. So when you're waking up, you're very, very numb from the procedure, and the pain is managed by pain management regimes that we come up with our oral surgeon, and we make sure to contact our patient to make sure that we're managing that discomfort. And that pain resolves within
Mhm.
2, 3 days. It's feeling so much better. And the teeth protect the surgical site, so you're not feeling it. And although it
Nice.
sounds gruesome to put screws into the jaw, you really don't feel them. The nerves are all in the teeth. So when the teeth come out, all that discomfort is gone. And within a few days, everybody's feeling so much better. I have lots of patients that say, hey, that didn't even hurt at all. I did totally fine. I didn't even need the
Nice.
pain pills.
That's
So
amazing.
it sounds a lot worse than it actually is. And I have lots of patients that can attest to that.
Yeah, we do have a lot of testimonial videos of patients that are whatever it was so worth it. It was amazing, and they're just smiling so big. So,
Yeah.
what do they say to you when they come back in a couple years later? Say somebody came in and they had, you know, infections and ongoing issues, and then they went to full arch dental implants. Fast forward 6 months or a year, and they come in for that first maintenance appointment. What do they say to
Mhm.
you?
They're all so happy that they've done the procedure. Nobody really regrets it. Everybody says that, oh, they forget about the surgery, and they just wish they had done it sooner. A lot of them are like, I don't know why I wasted so much time,
Yeah,
hesitating. And it's just a sense of relief. Like, I got it done. I needed to do this for myself, and I got it done. And now I can move on with my life, and I don't have to worry about it. It's just like a big burden for a lot of patients. And
yeah,
taking care of it is a big sense of relief. So I love our hygiene appointments. We have a great hygiene program here, and I love to see my patients 5, 6 years out of treatment and seeing how well it's working and how good they're doing. They know that they made the right choice.
that's wonderful. And we've recently heard about one of our Mile High Denture and Implant Center's ambassadors. She got her new smile, and her husband is also getting a new smile at Mile High. Have you heard? Does
Yeah.
this happen often?
It is not uncommon at all for a patient to undergo treatment and then their spouse or siblings or even their kids that might need it to see, hey,
That's
that wasn't
awesome.
so bad and worked out pretty well, and let's do it together. I'll even have some patients that come in and they decide to do the treatment together, and that's really nice. They support each other throughout, and maybe one partner is a little bit more intimidated by the procedure than the other. So the
Right.
more uh, braver one, I guess, might go first, and that really creates some courage into the more hesitant partner. And they just have great when they finish, they're done together. They enjoy their first meals together with their new smiles. So it's a wonderful
Life
way to
changing.
do treatment as a couple.
Life changing. Now, we are
Yes.
noticing out there in the world that there are more ads and more people talking about really cheap full arch dental implants, that people are making, special offers that are just ridiculously inexpensive, makes me question the quality. Or they talk about going
Mhm.
to another country where it's really cheap. What do you say to people that think that they have to pursue the cheapest option for this type of treatment?
Right. I mean, there's so much, unfortunately, misinformation out there right
Mhm.
now. There's a lot of ads that will come up with very almost unbelievable pricing that there is, and there's a reason behind that. They're cutting corners.
Mhm.
Either the doctors are not trained to the right aptitude to be doing the procedure. It is one of the most sophisticated things that we do in dentistry. It's routine for us in our office, but it definitely is a sophisticated procedure.
Mhm.
We believe that it needs to be done in a multi-specialty office with the highest quality materials, the highest quality dental implants, and laboratories that are used to fabricate the prostheses. Not every dental implant is made the same. There's many, many companies out there. We choose to use Nobel Biocare, which is a leader in the industry, a huge
Mhm.
presence in academia, and just lots of long-term studies that prove the success of their implant. I also love working alongside an oral surgeon and a nurse anesthetist to make sure that our patients are getting specialty care at the highest level. So I would
Mhm.
be wary of offices that are offering prices that are too good to be true. And going out of the country too is just a risk unless you're willing to return to that country regularly for any maintenance that you might need or any issues that you might have. It's really, I would warn against it. In America, we're definitely, as doctors, held to a very, very high standard.
Yeah.
And unfortunately, the rest of the world does not have the same standards as we do here.
Right. And it is an investment. It's an investment. To me, it sounds like it's an investment in your safety, your health and safety is part of that, to get
Hmm.
the most experienced people. And then the quality of what you're putting in your mouth. Once you get those full arch dental implants, you don't want things breaking. You don't want to have to go back continually. You don't want them to be sized in a way that doesn't work for you. You want the
Right,
best possible custom, high quality, experienced practice to do this work on your
right.
mouth. I mean, it's just so basic.
Absolutely. And you
Yeah.
absolutely don't want to have to do it twice. You just want to do it once and you want to be
Oh,
done with it.
yeah.
Unfortunately, there is a significant part of our practice that is redoing work. So it's challenging for the patient because now
Mm.
they're kind of paying twice and putting themselves through the treatment twice too. And it's just totally unnecessary. So,
Yeah. Yeah. So Mile High Denture and Implant Clinics is where you want to go. Mile High Denture and Implant
absolutely.
Centers. Go there. If you are following us on Facebook, if you're not following us, please do so now. If you are and you'd like to know more, private message us. And we'll also put a link for signing up for a free consultation in the comments of this live event post. So thank you so much for joining us, Dr. Lar. Thank you so much for sharing all your wisdom. We'll be back again in about a month with another live event here on Facebook. And we hope to see you there, and take care until then.
Yes, I hope to meet each of you at our Inglewood location. It would be a privilege to meet you and do a complimentary consult. Thank you, Lori Jo, for having me.